Hey everybody, it's Nathan with Fluid Health and Fitness. Today we're going to tackle another common overuse injury of the ankle, Achilles tendonitis, or more likely, accurately referred to as Achilles tendinopathy, as it is no longer necessarily just viewed as an issue of tendon inflammation. More recent studies show that the tendon thickens due to tenocyte proliferation, and other noted pathological changes also occur at the tendon itself. This pain is typically felt in the mid portion of the Achilles with activities like running, jumping, or cross-country skiing, where you need to continually and forcefully propel your body forward. While the cause of Achilles tendinopathy is multifaceted, it is generally known as a sport-related overuse or maladaptive training injury. Possible contributing factors are recent significant increase in activity or training load, range of motion deficits of the foot or ankle, much like that with plantar fasciitis. Those factors collectively put more stress and strain on the Achilles tendon as it is lengthening, controlling, or producing force. The good news is, just like with most overuse injuries, this can heal and, better yet, be prevented by balancing both local and global movement patterns in your body. If you have any questions on this or want to have a personalized program created for you so that you can avoid overtraining in general, please reach out to us at admin@fluidhealthandfitness.com. As a reminder, we offer complimentary in-person and virtual assessments and physical therapy options and would love to work with you. With that being said, today we are going to share with you a suggested exercise protocol that will help you to avoid overloading your Achilles tendon and surrounding tissues by addressing a few of the most common biomechanical imbalances around the ankles and lower extremities. This is certainly not an all-inclusive approach being shared today. Remember, the information presented here today is not considered, nor is it a substitute for medical advice. Now with that out of the way, let's go ahead and get started. To complete today's program, you can either use a percussion gun or a fascial release ball, a towel or firm strap, and an exercise band. Start off by releasing the calf, more appropriately named your gastroc and soleus complex. This is a common overactive and short muscle group that can lead to decreased ankle mobility associated with Achilles tendinopathy. Using the vibration gun, trace a line from the top of the calf all the way down to your Achilles tendon. Make sure to work both the inner and outer sides of the calf, looking for an adhesion or a trigger point. A trigger point is a hypersensitive area that can be relaxed with simple light grade vibration. Using very gentle pressure, you can isolate the sensitive spots for approximately 1 to 2 minutes or until it becomes desensitized and relaxed. If you don't have a vibration gun, you can use a fascial ball to do the same technique, aiming to create a neuromuscular inhibition of the muscle. By applying pressure between the ball and the tibia, your muscle should eventually relax, and once the sensitivity subsides, you can start to do a pin and stretch technique with a towel or strap with both the knee flexed and extended. The extended position is being demonstrated here. Again, approximately 1 to 2 minutes will do. Following these releases, weight-bearing stretches into ankle dorsiflexion are also helpful. For greatest benefit, incorporate the windlass mechanism of your foot with the knee both extended and flexed. If tightness or stiffness is present, these deficits can lead to excessive stress transmitted through the Achilles tendon, which may lead to those pathological changes at the tendon as mentioned before and cause pain. These range of motion restrictions can also cause shortened stride lengths, thus decreasing your overall performance. Hold these stretches for approximately 1 minute and repeat 2 to 3 times. Now that we've released the overactive muscles of the gastroc soleus complex, let's move on to an underactive muscle group, the anterior tibialis. You'll want to lie on your back or sit down as shown here with your knee extended. Wrap the band around the top part of your foot and pull your foot up and in towards you. What you'll notice is that there is little to no movement of your knee or hips. We are trying to stay fixated around our knee and hip and isolate the motion to our ankle. you'll want to perform 2 sets of 20 repetitions, giving yourself 1 minute of time to recover in between sets. Though it may seem simple, a single leg balance exercise, if done properly, incorporates neuromuscular control of your foot, ankle, knee, hips, pelvis, and trunk. Begin by standing by a wall in case you lose your balance. Next, dome the arch of your foot by pulling your big toe towards your heel bone. Try not to let your arch collapse during this exercise. Tighten the muscles of your hips and core to assist in maintaining your stability. Don't let your pelvis drop or your knee turn inward. Your balance and ability to support a neutral arch is very important. Or toeing out has been associated with increased risk of Achilles tendinopathy and other ailments of the lower extremity. If one cannot perform this simple exercise in a controlled environment where there is no dynamic activity or changes in center of mass, how can one expect to be able to control this when much higher demands are introduced to the body? Hold this position for up to 2 minutes and repeat 2 times with 1 minute rest in between. Once this is mastered, appropriate progressions can be made to increase the challenge and improve the simulation of related activities. The next exercise is eccentric or negative heel raises with both your knees straight and bent. Raising up on your toes, then slowly controlling the downward motion, has been shown to introduce the necessary stimuli for the Achilles tendon to heal and prevent injury. To perform this through a greater range of motion, use a step or a dumbbell as shown. There are simple progressions of this exercise. These are the progressions: up with 2, down with 2. Up with 2, down with 1. And finally, up with 1, down with 1. When you can perform the 1-to-1 exercises, you can add resistance by holding dumbbells. You'll want to perform 2 sets of 20 repetitions with a 2-second raise and a 4-second lowering, giving yourself 1 minute of time to recover in between sets. Again, remember to perform this with both your knee straight and your knee bent. Over time, you can increase the speed of the propulsion phase to better simulate sport-specific activities. Thank you for joining us today. Please like and share this video and subscribe to our channel if you found this helpful. Again, this session was dedicated to decreasing the likelihood of experiencing that sharp pain at your Achilles tendon. With the techniques applied today in this video, your body will be able to move more efficiently and transmit the forces in and around your ankle and foot more efficiently, and better yet, improve your performance. In the case that these changes do not help, remember there are more individualized treatment options available, like manual therapy or mobilizations, and other modalities that a skilled physical therapist or kinesiologist may be able to assist you with. If you have any questions on anything covered today or are interested in a more personalized treatment protocol, please reach out to us at admin@fluidhealthandfitness.com. And remember, think globally, not locally. Your body was designed to move, so stay in motion.